And welcome back again. Of course, we are getting a chance to kind of talk about the issues of depression and a brand new treatment that is going to be going on. Dr. David Kent, who is a psychiatrist locally in the area and has been for a number of years, and a patient of his, Patty, we're just going to identify her by first name because we're talking about the fact that depression. Now, the treatment of depression seems like it's almost as old as psychiatry and itself, and because people have always wanted to seek this out. But I think it's one of those there's been such a wide variety of treatment that's happened that there's really been all kinds of issues in terms of really what to do to be successful.
That's correct. I mean, I've been practicing here a long time. I've known you a long time. Almost 30 years I've been here, and I've used pretty much all the modalities of treatment, so it's exciting to talk about something new at this time.
Sure. Now, the chemical treatment was one of the most common ones, right? I mean, to like give people a certain amount of drugs. Did you find that you were kind of like always constantly adjusting those medications for people? In other words, let's try this. The one phrase that people never want to hear their doctor say?
Well, that's true. 55% of people who present for depression will respond to medication. Sure. But then there's the other percentage that doesn't, and then after that drops off 50% in response rate to the other medications. So it quickly drops off in effectiveness.
Is that because there's really, I mean, there's no two patients that are really alike and no two depressions that are alike?
I do think it's the case. I call it custom work when patients come in. It's very much custom work, and so I've done all the medications over the years, so I'm an expert at that. But it's nice to have something new to come along. So,
Penny, in your case, was this a situation like depression didn't just come on? You probably had it a long time, but you were finally got diagnosed. Did you like just like constantly question yourself?
When I was a child, I was always sad, and I was never really happy, and I was always looking for that to be happy. Right. And then when I had my third child, that's when I went into a major depression and was very suicidal and stuff. So I got help for that. Yeah,
but was it more conventional? Was it like like treatments, like medications, things like that?
Yeah, I started off with medications.
And did that
one
work
medication
for you?
After. I went through a lot to get to the one that I've been on for a long time, but it never. You always had to get something else to help go with it.
There's side effects, in other words.
There's side effects.
You're taking medication because of the medication, and I'm sure that after a while, as a psychiatrist, you feel like you're treating the treatments, and after all that, now you've got a brand new treatment, and you use magnetic. So it's called TMS. What does TMS stand for?
TMS stands for transcranial magnetic stimulation.
Okay, so it's magnets, so like really powerful magnets.
It's an electromagnet. And it's pretty powerful, and it's evolved over the last few decades, so it's very sophisticated. They can actually focus that energy on any area of the brain they want to, pretty much, and so it treats not only depression but many other conditions. So it's kind of exciting tool that I have now that I never had before.
It does seem like a really exciting tool. It's not electric shock therapy, though.
No, it's not the same.
Is it even similar?
Well, they both stimulate the brain, but in different ways. Electroshock uses electricity to get the brain into a seizure, whereas TMS uses electromagnetic fields, and it stimulates the neurons to fire. And it doesn't go as deeply, and it doesn't involve all the brain like ECT does.
Sure. And actually, like magnets and whatnot, they've been used before on other parts of the body because we've discovered that the magnetic fields actually will improve. So does this need to be approved, or has this been approved by the FDA, or is this because magnetic treatments are out there you could use it?
The FDA first approved it in 2008.
Okay.
So it's been around a while. Medicare pays for it. Almost all the insurances now pay for it. So it's well accepted as a standard treatment for depression now.
Okay, so now do you find that you can actually treat, like Patty, do you get treated with this and don't use medication anymore?
I'm off my medication now.
You're off.
Completely off. And I've been doing the treatment for like almost 2 weeks. Yeah. But from the first treatment, I was in remission, I felt.
Oh, really? So it made a huge difference right away?
Oh, yeah.
And I would imagine not taking pills for pills probably really helped.
I had to slowly go off my medicine,
Sure, yeah.
But yeah, it was like, and then I've just been getting better and better. I've never been this happy.
All right. So if folks, we can only cover so much of this in a short period of time, but if folks want to get in touch with you, they can. Do they contact you through your office?
They can, but also TreasureValleyTMS.com.
Okay.
There's a self-assessment on there. It takes just a few minutes, and they can find out if they're a candidate or not.
Very good. Well, if you want more information, that's all you have to do. TreasureValleyTMS.com, and take a look at that. Well, thank you very much for coming in. Appreciate it. We'll be right back in just a moment. We've got more news and weather on the way.